Yes, our organization does a lot of focused events like multidisciplinary cancer forums on particular topics, live surgery masterclasses, oncopathology seminars, tobacco control events, and oncology seminars for non-oncologists, oncology seminars for patients, survivors, policymakers, politicians. But at present, on 27th July, we are going to do the World Head and Neck Cancer Day, which is going to be commemorated worldwide for the first time. It was announced last year in New York on 27th July, and I've been appointed as the national coordinator for Russian Federation. So as it is the first time, we have decided to do it locally in and around Moscow, where we are gathering a few head and neck cancer survivors, and most important, we are doing a 1-week cancer detection campaign in the outskirts of Moscow, in the small city of Korolyov, which is very close to Moscow city. It's called a science city, and there will be a group of cancer specialists together with me. We'll be looking at volunteers, just the conditionally healthy people will be coming to us, so we will be just screening them for cancer and giving them, if there are any investigations needed, we'll just give them the proper advice regarding that. It will be a free campaign for 5 days, 5 working days, and we are doing in a small family clinic where there are no cancer specialists. We just come in from different cities, specialists are coming in and doing that on a voluntary basis. But we won't be doing only head and neck cancer. As it is a cancer detection camp, we'll be looking at all cancers. So there will be a dermato-oncologist, there will be a breast specialist, there will be a gynecologic oncologist, there will be 2 head and neck specialists. So basically, and there will be somebody who's specialized in abdominal oncology and uro-oncology. So basically, we'll be covering the whole spectrum of oncology in terms of early detection, and we'll be giving some short seminars for the healthy individuals who come, some videos, and how they have to look at their own health to really detect cancer at the right time. And apart from that, on the 27th in the afternoon, we are going to do in Moscow city center in a hotel, we are going to gather a few of cancer survivors, head and neck cancer survivors, and the key head and neck cancer experts from all over Russia and ex-Soviet states, plus a lot of journalists, policymakers, and politicians. And we'll be doing a short program where we will talk about the significance, about the suffering caused by this disease, and about the problems which these patients face with proper real examples, and the issue due to the main issue of the lack of medication, because head and neck cancer unfortunately is so far a more surgical cum radiation treated disease, less of a medical oncology disease, and we hardly have less than a handful of trained head and neck medical oncologists in some countries, and that is a challenge. So we are going to focus on all these issues which our patients are facing and our specialty is facing, such that to create an awareness about this. And of course we'll be talking about tobacco control. Our team was the one in Russia which was facilitated and reached out with all other tobacco control advocates in the country to our President Vladimir Putin and convinced him to sign the law for Russia to join the Framework Convention on Tobacco Control in 2008, and that is really has given enormous effect in the society today, and we'll be talking about that also, and that will end with a reception, and that is what we are planning for the 27th of July. Russia is a unique, I would say, system. Russian cancer care system is a unique system. There are many things the world can learn from Russia. Because by the time President Nixon signed the National Cancer Act in the United States in 1971, Soviet Union already had the largest network of comprehensive cancer centers in the world, which were about 100, if I'm not mistaken, more than 160 cancer hospitals throughout the world covering the entire population. That was the coverage. So access to basic cancer care was there for everybody. That's a different question about the quality today. It's very variable. there are centers like the Blohin Cancer Center in Moscow, where I was trained, treated, where I worked for 15 years, and the Herzen Cancer Center, and a few more other cancer hospitals in Moscow, like the 62nd Cancer Hospital and many others, which are really very good. There is one in Tatarstan and another in Samara, which are also really very good world-class cancer centers. But we have the other next level of many other cancer centers. There are a few more very good centers also. I'm not going to name all of them. And there are another category of centers, because we can just put them in a hierarchy of in terms of their quality and in terms of also what they can do. And we do have challenges, and the biggest challenge in Russia, what we have today, is the magnificent distances which people have to travel in spite of the number of centers we have. Even though Russia has one of the largest, if I'm not mistaken, Russia has the highest per capita number of doctors in the world. We have 49 doctors for 10,000 individuals. It is even almost double than the United States. And but still, we do have challenge in terms of subspecialty training. We do have very highly skilled trained doctors, and unacceptable level of training for the rest. So there are big challenges there. And we do have other challenges, like in terms of tobacco control, where we are already progressing very well in the last, after the signing of after Russia joining as a party to the Framework Convention on Tobacco Control. And another big barrier we have is that even though Russian is the most spoken language in Europe, Russian is not a medium in 99.99% of international meetings worldwide, except those which are done by the Eurasian Federation of Oncology and a few more organizations in the post-Soviet region. So the interaction of Russian doctors with the rest of the world is highly minimal. We have, as Alberto Costa, the director of European School of Oncology, always says, less than 5% of doctors in Russia know poor English. The reality is that less than 1% of them know good English. So it's for this situation to change, it will take generations to change. The younger generations are learning English, but we have to deliver knowledge today. That is the reason why we are doing all with simultaneous translation. And another biggest challenge, which is the biggest limitation for the interaction of Russian healthcare professionals with the rest of the world, is that the wages of Russian doctors are not yet to the mark. And some 1 year ago, it was still okay when the ruble was stronger. Now the ruble has gone weaker, and it is once again, the wages are, as per international standards, once again has dipped. And one way, thanks to the sanctions, Russia is going to be, the economy will be getting stronger with local production, many other things. There is a different thing, economic and political issue. As doctors, we don't touch that, but that is not, unfortunately, helping us. The reality as of today is that once again, our doctors are poorer. And so that makes us that the work we are doing in delivering knowledge, bringing the best experts from all over the world to Russia and the ex-Soviet states, and doing these seminars and meetings and training courses, live surgery masterclass and other things in-house there, delivering that in-house, and not charging big amount of money like the international meetings where 500 or 800 euros, which is very expensive for our doctors. So we are addressing our best what we could do. And most important, which I want to say, is our organization in the last 5 years has been thriving in most projects with zero pharmaceutical funding, in just a few projects with some pharmaceutical funding. That is a very different model, because I, as a cancer survivor, I committed a good amount of my own wealth to the organization, and every year I keep doing that, and we give stipend and other things from that money and keep it running. And I'm not alone. There are some of my former patients, my friends, some of my colleagues in different countries who also commit to that. That is how, with the professional social responsibility, we are running this organization.